Sciatica can be the biggest pain in the butt. In this video, I'm going to show you how you can tackle it with massage therapy and get rid of it for good. Hey there, I'm Ty Clark. I'm a licensed massage therapist. Now, if you are here for massage techniques, then you are in the right place. I like to show unconventional methods to help heal your body on yourself or someone else. So if this is something that sounds good to you, make sure you've subscribed below, then you can keep getting these videos. And also any links or descriptions or tools that I mentioned in the video, I'm gonna link to in the description below. All right, this is part 2 of this series, and you can check out the other video that I did last week on this, and it talks about why sciatica is so misdiagnosed and mistreated and why surgeons tend to jump into surgery way too fast. Medical professionals often focus on the wrong areas of the body, so you can click that link there if you want to watch that first. But today I'm going to show you the areas that I focus on to help get rid of it for good. Now, sciatica is a term that describes anything that can be like numbness or tingling or pain down the sciatic nerve. And all of the nerves come out into a nerve bundle here, and they go all the way down the leg. You can feel pain or numbness anywhere along that nerve. Sometimes when people get pain all the way to the toe, they're told that the pain is coming from their back. But as I found in my clinic and through my experiences, even in my own body, I had pain all the way to my toes, and it was just fascial adhesions in my glutes. So we need to focus on the right areas, and I want you to be educated about what will actually help this heal. All right, now let me show you the massage techniques that I do for sciatica. Now, I am not exaggerating when I say that this massage is a really involved massage. Expect 90 minutes to 2 hours of work and possibly multiple sessions because of all that's involved. Now, right away, you're going to notice that this is going to be a little bit different. I'm starting on the front of the body, and it's because this is the key to getting rid of sciatica for good. The shortening of the front of our bodies from sitting in front of computer screens seems to be the culprit so much of the time, and I would even say like 75% of the cases that I see have this issue as the leading cause. Now, the first thing I'm going to do is warm up the stomach area, and then I'm going to focus on the psoas, which is right here in the front of the body. This muscle is a deep ab muscle that attaches to the spine and inner thigh, and it can get chronically shortened. When this one gets pulled, you feel it in your back, and it feels like back pain, hip pain, or even SI joint pain. But I start here for 3 reasons. I kind of like to get the most uncomfortable part out of the way right away. Number 2, when the psoas and the hip flexor muscles are pulling, the back just can't release until these are released. Number 3, I like to do psoas and quad stretches when all of this is finished and they require you to be on your stomach. And they're much easier to do when everything is warmed up. I'm about 1 inch away from the belly button, and after a good inhale and exhale, I will press straight down onto the muscle. They will lift their knee up to activate this muscle, and you can feel it tighten as this is the primary action of the psoas. Now they'll drop the leg down to the table, turn the foot in and out, and then pull it back up. I repeat this at least 5 times here, sometimes adjusting my squat a little bit lower, and then I'll do a few more a little closer to the hip bone. Next, I'm going to move to the lower leg. You can definitely spend some time on the outer quad, but the important part is to hit the inner thigh. We are going to do 2 things here. We're going to warm up these inner thigh muscles so that they will stretch, and then we're going to separate those fascial adhesions in the middle of the muscle so that they can each move independently. Gracilis, adductor magnus, and sartorius, vastus medialis, all of these tend to get stuck together. And after warming, I'm going to spend some time slightly moving my elbow to help unstick the fascia between these muscles. Now, inner thigh work can be really tender, so make sure that you lighten up your pressure here. For deep tissue on the inner thigh, I'm just going to lightly take my elbow and do some slight movements where I'm just actually pulling on the fascia to help it release. It's
not easy to see exactly what I'm doing here, but you can really feel it. Now, when you are doing massage here, you can kind of get a sense if these inner thighs are pulling on the back. If their hip drops open like this and they can feel the pain in their back, or they have a really hard time just opening up the hip, it's not very flexible, that's a pretty good indication that the inner thigh muscles are involved in that pain. Now, definitely add in this Thai massage. It doesn't look like much, but it is very powerful, and if done over a period of time can single-handedly eliminate back pain. Now you can also work the inner thigh like this. This is some active release. I'm going to slowly work my elbow up the muscle, and after I find areas that are stuck, I'll just nicely move the lower part of their leg, and it's a great way to get it to release. And now that we've taken some pressure off the SI joint, we're going to start the work on the back. Now this is going to be the meat of the massage, and it's going to be where they're feeling the pain. So I like to start off with some nice, relaxing movement. These muscles are usually overstressed and extremely tight, so I like to really approach them gently. Now here I'm going to start with some fascial release right off of the spine on Erector Spinae muscles. So I'm going to pin one part of the fascia, and I'm going to stretch away with the opposite hand. This doesn't look like much, but it really is effective, and you can definitely feel it. These are the muscles that are typically pinching the nerve or actually causing a disc to bulge. So we've got to make sure we address them. Now the other muscles that we want to focus on are these muscles that bend the spine side to side, and that is your QLs, or your quadratus lumborum, and they're typically overly tight, and so some light pressure pressing into them, kind of pulling the fascia away from each other in this spot is really effective. Now, an even more effective way to get into the QLs, since they are underlying the Erector Spinae muscles, is to use your elbow. And you're going to go in with kind of an inward and an upward movement. This is another one that is slow, deliberate, and it's going to take a while, so I'm not going to film the whole thing, but this is kind of the general idea. There's a couple more spots we do not want to forget here. And one is the overlying thoracolumbar fascia. So this is a big fascial sheath that just covers the entire area and could be solely responsible for the pain. And so we want to make sure that we have all these fascial adhesions released. We're going to do this in a couple ways. We're going to use cupping and gua sha. Cupping, in my experience, is really effective at getting more of the surface fascia. And one of the ways that I like doing this is to either place a bunch of cups closer together right here on the whole fascial plane, and then take them off one by one, and then you can even do some movement with the cups. The other thing that you can do is gua sha, but you have to remember that you need to stay over bony structures. You want to avoid going over something like the kidneys because it can damage organs, so only right directly over the spine or over the sacral and coccyx area. Now you can see on Jim, he's getting some petechia right away, and if you haven't been following me, you know that I'm a huge fan of gua sha. This is going to release things right away, and whenever I use it on the lower back, people are generally really happy. They usually walk away feeling significantly better. I think gua sha is one of the most effective things to use in the upper glutes right here on glute medius. And as you can see, he is getting some show, which means that he does have some fascia that's stuck here. And this was definitely key in me getting better from my own sciatica. Now moving on to the glutes, there are 4 spots to remember here. I'm going to focus on warming the entire section first, and then I usually start at the top with glute medius. This muscle tends to get ropey, and so doing some movement that pulls it down and flattens it out will really help. Some cross friction can help it achieve this as well. Cross friction can sometimes irritate the sciatic nerve. So you have to be kind of careful using it early on in the process. So I'm going to start from the top down with glute medius, and I'm just going to go through and see if I feel any muscles stuck together. It's going to feel thicker, it's going to feel harder to move my elbow through. And then when I find these areas, I love using this technique where I pin and then I stretch it with my elbow and pull in the opposite direction with the hand. It's highly effective. I'm just going to kind of search through the whole glutes for these areas. This does take time, and again, I'm not going to film the whole thing. But if your fascial adhesions are in the glutes, this absolutely needs to be done. Sciatica can sometimes be mistaken for piriformis syndrome, which is this muscle right here. This muscle crosses over the nerve and can pinch down and cause all of the pain that you are feeling. What I think some people get wrong is it's not really the piriformis in particular. It's usually all of the glutes and fascial adhesions within different muscles inside the gluteus. The piriformis just happens to be the one that is on top. I found that even if the piriformis is tight, it's usually a superpower combo of these muscles that pull everything snug. So do not forget this area. Now this is just your standard Piriformis release, and we all learn it because it's effective. Pinning that muscle and using the foot for active release really can loosen things up in the glutes. Now if you're going to hit one spot in the glutes, it's right here where a bunch of muscles come in together. This is where I will do some serious deep fascial release, but also some gua sha. If you're doing it right, if you're pulling the fascia up, the person you are massaging will feel a little bit of a burning feeling, and I always tell my clients that's a good feeling. And then the last one is the spot where the sciatic nerve exits the glutes, right at the sciatic notch. And I really like to put the leg in this position to access it better. You can either do some cross friction here with your fingers or your elbow, but just be highly aware that you are awfully close to the actual nerve, and too much pressure here can increase symptoms. Just keep a good communication with your client and have them let you know if they can ever feel it. Now we're going to head down to the hamstrings. A tight hamstring can actually cause a lot of the problems listed above, so don't forget this guy. Typically though, it's usually feeling the symptoms rather than being the actual cause, so I won't focus as much time on it, but doing some deep tissue work in this muscle and all the way down to the calf will be much appreciated. Now I know these stretches are at the end of the video, but that doesn't mean they're any less important. You've done all of this work to get the body warmed up, and it's going to respond so well to these stretches now. Make sure you include this quad stretch, and then you can take it a little bit deeper by lifting up the knee. I'm going to place my knee underneath their knee and then just slowly lower forward. And then if you want an even deeper stretch, you're going to have them press their leg against yours in the opposite direction for 10 seconds and then have them completely relax that quad. You are going to really make progress there. Now I actually will get on the table and do this tie stretch because I have found it is so effective. It really addresses the psoas and just gives the right amount of pressure. All right, let me know what you think in the comments below, and we'll see you in the next video.